Alrighty, well, let's get started. Today's webinar is BioFlex Professional Webinar Series, Laser Therapy for Post-Surgical Healing, and do a little bit of homework here, not homework, but just to preface this by saying I do two types of webinars every month. I do one for professionals, healthcare professionals that have our equipment or maybe are interested in the equipment. Anyone can listen, but the advice and the recommendations and what I'm trying to do here is geared more towards healthcare professionals with, I'm getting a phone call, with business phone call, with respect to using our BioFlex laser therapy equipment. And the other stream of webinars I do is more geared towards consumers that use our consumer-like devices, like our personal therapy systems, those kinds of things. So just prefacing that, and also all my webinars are recorded and uploaded onto our website. So you can always find them there as well, too. So let's get started. And what I wanted to do today was talk a little bit about using the equipment for helping accelerate wound healing, especially as it relates to post-surgical healing. So typically this is like an open type of surgery where they're using a scalpel to do an incision. Obviously, could be a joint replacement. It could be arthroscopic surgery. It could be post-surgery after any kind of application that would be done by a surgeon. So I'm going to review wound healing, and then the effects of photobiomodulation or laser therapy. Of course, there's multiple names for it. I'm going to switch around, but usually I stick to either PBMT or photobiomodulation therapy, or sometimes it's easier to say laser therapy, although that's not really accurate. And then I'll present a little bit of research on the topic. There's lots of it, just a few, especially some of the stuff that's done by our company, or at least they used our equipment. And then I'll get into exactly what I'd recommend you would, how you would treat these wounds using our equipment. Please ask me any questions as we go along in the Q&A box. I also, I'd appreciate if you can let me know where you're from, perhaps your first name. If you have our equipment, anything that sounds interesting or fun, put that into the chat box. That would be great. So again, questions for me, Q&A box. We'll get to those at the end. And if you want to give me some information or chat amongst yourselves, you can use the chat box. Okay. Right. So we're talking about open surgery wounds here, specifically scalpel incisions, and then of course the resulting wound, and trying to accelerate the healing process. So obviously there could be one incision, there could be multiple incisions. You know, this is the kind of thing that we're dealing with here. Now, of course, some wounds can be closed using just regular, stitches, nylon thread, or what have you. They may dissolve. I personally had some surgery on my finger maybe 2 months ago. I had some cysts removed. You know what? I don't even know what they were. They couldn't figure it out. They weren't Heberdins or anything, nodes. They thought they were ganglions. And anyway, I had this exact type of surgery. I actually should have showed pictures of it, but and I did use laser therapy. Someone keeps calling me, and I cannot answer that. And like zero scarring, and it healed really fast. And it was about maybe a 3 centimeter, 4 centimeter incision. Other wounds, bigger wounds, larger wounds, oftentimes they use staples or metal clips, which hold the edges of the wound together. And of course, these particular ones tend to have to be removed specifically by the healthcare provider, and they usually use a special tool to remove those. So it's not recommended that you just kind of get a pair of pliers and pull those out on your own accord. And sometimes they use other things, like they use special type of tape or small strips of non-allergic tape. It's meant to keep the wounds together. It can be used in conjunction with staples and stitches, or just on its own, depending on where the wound is located and the type of wound it is. And of course, it can also use adhesive glues as well on smaller wounds, and typically ones that aren't very deep. Now, the point here is that laser therapy can be used directly over these wound closing techniques. provided that there's a clear, transparent barrier. We recommend something called 3M Tegaderm, but you can use other things as long as it's transparent and clear, right? And it provides a barrier, hygienic barrier between the equipment. You can either wrap the equipment up with the wrap, or you can, in the case of Tegaderm, it goes right on the skin, and so light can go right through that. We're actually using 3M Tegaderm for a clinical trial on wound healing I'm going to mention coming up. So typically, large or deep surgery incisions, they can take many weeks to heal, 6 to 8 weeks, maybe even longer, depending on the complexity and what was being done. Of course, smaller wounds, surgical wounds heal much faster. Like mine was good to go within 2 weeks, I'd say. I was back actually playing squash within a week of having that surgery, and I treated it with laser. Obviously, patients that have medical issues or certain medications, these may slow the healing process. So one needs to be aware of that as well. And using laser therapy can dramatically increase the healing, decrease the healing time, as well as improving collagen formation and the visible scars, as well as the deeper scar tissue. I'm going to talk all about the benefits of photobiomodulation very shortly. Let's first talk a little bit about wound healing. There's different stages of wound healing. Very quick is what's referred to as the hemostasis. It's not really a stage, but that's what initiates the stages. So I'll walk you through what's going on there. I'll also walk you through some nutritional support that I found online as well that you might want to recommend to patients during these different phases of wound healing. Then is the inflammatory phase. This can be as short as a day or two and maybe last a week or so. You can see that in the blue. Excuse me. Just getting over something, so I have a little occasional cough. And then into the proliferative phase. This can last upwards of a couple of weeks or even longer. Excuse me. And then into the remodeling or maturation phase, which is the last stage going on. And what's interesting is you can see sort of peaks of different things going on, like fibronectin production, which is a glycoprotein that helps accelerate, gets wound healing going, has lots of different roles. And then you can see type 3 collagen and type 1 collagen production. It's really important to initiate collagen production, taper off type 3, which is kind of like a spider's web kind of collagen, and then getting it to mature and getting type 1 collagen produced, because that's the kind of collagen that gives the wound bed more elasticity, less actual visible scars, and overall better not just visible appearance, but also function to the deeper tissues. So we definitely know that laser therapy can really help promote the collagen production and formation, especially maturation into type 1 collagen. This little blurb on fibronectin and what it does. Actually, I started reading about it. I didn't know a lot about it prior to this webinar, and it has lots of different roles. They're still discovering some of the things that it can do in the body. Even it can have to do with infections and so forth. But it is very critical for wound healing, and you can see it being triggered in different phases as well. So if you look at the timeline for wound healing, you can see that within the first hour, you initially have vasoconstriction, which tries to stop the blood flow, and you get coagulation. This is all occurring pretty quickly within a few minutes. And then you have some subsequent vasodilation to allow for neutrophils to start to influx into the area. You start to get that inflammatory phase within an hour or two, right? And then you see the redness. I don't know if you saw the cover picture for this webinar. You can see sort of the incision and the redness around the stitches. If you've ever had stitches, you'll notice that right away. That's the inflammatory part, and that should go away pretty quickly, even quicker with laser therapy. And then as this is occurring, you start to get different cell types involved. Macrophages are involved. You get the granulation tissue forming, which is critical for wound healing, epithelialization, and then contraction of the area, the new blood production, angiogenesis, and then you get that maturation, remodeling of the tissue, surrounding tissue, skin, and deeper structures, and you start to regain the strength. And notice that the regaining of the tissue strength, even though the wound looks like it's all healed, that can occur for many weeks or months, even years afterwards, which is really important for things like post joint replacement or those kinds of things where, you know, you want to be rehabbing and not just treating with laser, but also doing a lot of exercises and rehab many weeks and months in, so that you can have proper function of the area that was that surgically intervened. So in hemostasis, obviously, I'm not going to spend a lot of time on this. I think we all understand the concept of bleeding, right? If you haven't taken it, there's all sorts of pathways, and intrinsic and extrinsic pathway, and different factors, blood factors that are going on. I had us all memorized at one point when I was a student, but anyway, if you want to look at it, there it is. But we don't need to really focus too much on that. What's probably most important is we want to, because that's the initial phase. By the time we get into the inflammatory phase, within a few hours to the next day, that's when you can start to apply laser therapy. So you see quite a dramatic improvement and shortening of the inflammatory phase when you add laser therapy. So typically it lasts up to about a week. It can last longer, but that's the time frame. You can shorten the time by several days, more than likely, if you're using, and there's no complications if you do use laser therapy within 24 hours of the surgery. You will get, of course, some swelling or edema, some redness. I've mentioned that, and of course, some pain involved. And laser therapy can help with all of that as well. This is the time when the immune system is starting to really go into action to ensure that any stray bacteria are dealt with, and there's no infection going on. Some nutritional support during this inflammatory phase can include vitamin A, bromelain, ensuring that the patient has enough protein, and perhaps vitamin C. And you can see some of the dosaging there as well too. So these are just some things that you might want to recommend as well to your patient. Then you get into the proliferation phase, which is basically the granulation tissue forming the wound bed. You start to get fibroblasts being activated, starting to produce the collagen, initially type 3, and then it matures into type 1. Then the wound edges start to contract, and the epithelial cells migrate to the surface of the wound to close it up. And that's, you know, essentially what's going on during proliferation. During this phase, you can continue with vitamin C, maybe add some glucosamine, which of course helps with the collagen formation, of vitamin A, and perhaps even zinc as well, which can help cells proliferate and even help with protein synthesis. And then you get into that maturation phase, the last phase. Again, this can last a few weeks minimally to a long, long time. Again, depending on all sorts of factors here. Of course, the length of time is dependent on many factors. Especially if there's any comorbidities or infections or complicating issues, that kind of thing. And then as that wound is being filled in and sealed and strengthened, then of course it gets the visible and the deeper scar tissue formation forming. Nutritional support during this last phase is ensuring that the patient has enough protein going into the body to help, because this is the body requires a lot of amino acids for this type of maturation phase. Okay, so photobiomodulation, I think everyone listening in is familiar with what it does for the most part inside the cell, so I won't go on and on about that. What's important to understand here is that when you're treating a wound, you want to treat the wound bed directly around the wound, but you also want to treat around the wound, because we know that there's the direct effects of photobiomodulation. That is where the energy of the light's being absorbed directly by the injured, or in this case, you know, the surgical area of the tissues that have been damaged. But of course, it's a huge effect systemically on the blood that involves immunomodulation. And of course, the whole process of wound healing involves the immune system. So you want to ensure that this is also triggered, and you do that by treating around the area as well. So not just over that incision, but around the area is critical to get a nice positive immunomodulating effect into that area. So these are just some of the key points of what photobiomodulation is helping to do, including increasing epithelialization. It does that by increasing the mitotic activity of endothelial cells and epithelial cells. It helps to reestablish microcirculation, reduce edema. I'll talk a little bit about that later. Reduces pain, mainly due to the inflammatory aspect, but also it can have an analgesic effect, especially if you use intense red light, like a red laser probe, in conjunction with the near-infrared laser probe, gives a nice analgesic effect. The cellular effects, I think we're all aware of, its effect on ATP and synthesis of DNA and RNA. It can accelerate the formation and the extent of granulation tissue. The mitochondria, number of mitochondria actually increase as well, helping with cell functioning, neovascularization, matrix synthesis, fibrinogenesis, of course, reduction of inflammation. We know it has an effect on certain cytokines and growth factors that can help with wound repair and reduction of pain. Its effect on immune cells like macrophages as well, established and understood. And of course, by causing vasodilation, it can help with tissue nutrition and oxygenation. Oh boy, that's a tough one. And of course, facilitating wound closure, angiogenesis, and tensile strength. So I think everyone's seen the picture of Andre Messer. He serendipitously discovered the effects of red light from a ruby crystal laser back in the 1960s. And as a refresher, you may remember he first discovered that he was trying to work on some cancer cells and did some incisions, and he noticed that the incisions were healing faster. So he did the secondary experiment where he had a control and he did skin flap wounds. So this would be like a scalpel, taking out a chunk of skin, removing it, and then waiting for the body, in this case, the rat body, to close it up, right? Similar in a human being. Although some humans might be rats, so, it could be pretty similar too. Now, if you look at the control, this is the same time frame over a few weeks. When you compare the laser-treated wound to the control-treated wound, you can see that it's significantly closing up, contracting much faster than the control. This was the one that was treated with red light directly over it, okay? And then if you look at the adjacent wound, which was not treated with laser, but was adjacent to a wound that was treated with laser, it's also healing faster than the control. And so again, the idea, the understanding and his hypothesis is that red light stimulates wound healing, closure, and wound healing itself, but treating the effects can also affect adjacent wounds. And so therefore treating systemically, which is what I mentioned earlier, is important, because the effect of just treating that one laser was carried in the blood. And of course, that's the immune cells that are triggered and helped. I see there's a question. I'll definitely get to your questions at the end of the webinar. So please ask your questions so I can get to those at the end. There is, when you think about it, the first application was wound healing. So since the 1960s, there's been a huge amount of wound healing research. Unfortunately, majority of it is on animals. And so it's a little bit more challenging, although there is definitely stuff on humans and clinical trials. We need more of that. And actually, we're doing that as well. So I'll talk about that. But with reference to the different stages of wound healing, you can see here that this represents those stages, and you can see references here that have shown that photobiomodulation has a positive impact on inflammation, proliferation, fibroblast proliferation, granulation tissue formation, collagen, all the things I just mentioned earlier, okay? The research has shown that it has benefits. Again, mainly in animal models. I get it. It's not always 100% transferable, but the mechanisms are almost identical. So you can pretty much say it's going to be similar in humans if you use correct dosaging. And of course, there is certainly literature to suggest that as well. Some of our research we published, now this was in a clinical trial, but it was a nice article specifically on BioFlex laser therapy for treating wound care, for treating wounds in Wound Care Canada. If you wish to actually download the article, it's free online. Just Google search Wound Care Canada laser or laser therapy, and this will pop up. And you can go right to and go to that PDF, and you can read the article that was published by, I believe, Dr. Fred Kahn at the time, a few years ago, of course. We are currently involved with a very large clinical trial out of Hamilton, McMaster at 2 sites. It's called the application of Photobiomodulation with multimodal analgesia to improve pain relief and wound healing for patients having elective C-section. It's a pilot trial, but it's close to 200, obviously, females in the study. It's being run by Dr. Shantana. He's out of McMaster at Hamilton Health Sciences and St. Joe's Healthcare. And it's a very large trial. The funding actually was in part, a large part, provided by SOPHI, which is Southern Ontario Pharmaceutical and Health Innovation Ecosystem. So this is now underway. They're using specifically our equipment to treat females post C-section. And what we're hoping to show, of course, is that it can accelerate wound healing. By the way, the women are treated during their time in the hospital multiple times during the day, during that initial acute sort of phase prior to them going home. And then we'll see how those results look after, well, it'll be well into next year by the time it's all wrapped up and finished. So look out for the results of that. I'll certainly share those when they're available and published. We had another trial using BioFlex equipment on specifically bruising and to some degree pain. They didn't look so much at the wound healing aspect, but this is post rhinoplasty. This was out of Iran. They looked at 60 candidates. It was a blinded randomized control trial. And what they found was that when they compared to the control subjects that didn't have laser therapy, that they were looking at periorbital bruising or ecchymosis, right? So bruising around the area where the surgery is done. Of course, that bruising will occur in any kind of post-surgical kind of area, especially on the face, because there's so much blood supply there. And what they found was that indeed it did help reduce the bruising or ecchymosis significantly. And they concluded that it would be helpful to use it post, in this case, rhinoplasty, but obviously any type of surgery. A few other publications, research publications. This one specifically looking at superficial wound healing, so not surgical, but superficial wounds. A lot of the wound healing, by the way, is actually not post-surgery. It's like ulcers and those kinds of things, but it's transferable, obviously, or relatable. This one looked at 22 young people. They're average age of 21. They did abrasions on their forearm. I should have shown you pictures, but they basically created a wound. So you can imagine, like, if you scrape your knee, that kind of issue. So there would be, bleeding in a kind of like a wound bed. And you can see the lights that they used. They mainly used LEDs, but they also used a laser near infrared. So pretty similar to the wavelengths we would use, other than the higher wavelengths. I don't know why they used higher wavelengths, but they did. But they also use a standard 860 or 660 and 800s nanometer. And what they found, so they were measuring the wound area and the contraction of the wound up to 20 days post creation of the wound. And they found that the laser therapy enhanced the healing as measured by wound contraction. So they found overall that the laser treated group compared to the control, the wound was contracted and healing faster post 20 days. All right, so let's get into BioFlex, right? So we actually have a wound healing protocol. Dr. Fred Kahn, he was a vascular surgeon, so he's very interested in wound healing. And to this day, we have a wound healing facility within our clinic that we see a lot of wounds, not just post-surgical, but all sorts of wounds that are recalcitrant and not healing up very well. So the protocol is a little bit different than standard protocols. The time, I'm going to talk about that. It can be as short as maybe 4 or 5 minutes for the array, and as long as 10. And I'll talk about why. The red light initially is pulsed at 50-50, or that's 50 cycles per second and 50% duty cycle. I'll talk about this shortly. And then you can see the dual infrared arranged there as well. And even the infrared probe is pulsed as well. The idea here is that you don't want to overstimulate, especially superficially. You see the duty cycle is a little bit down and the pulse rate as well, just trying to mitigate excessive exposure of the light superficially, because there is a lot of issues going on superficially. You don't want to do too much, because then the effects start to wane. If everyone's familiar with the biphasic dose response and photobiomodulation, you know that when you have too little light, there's really no effect. And then you start to increase the dosaging, and you start to get a much better effect. And then if you increase the dosage, the actual effect of photobiomodulation starts to decrease to the point where it's not helping anymore. So you have to be careful not to overdo it as well, too. And you can kind of tell that because you can see how the wound's healing, especially superficially, right? And then that gets into stage 2 and then stage 3. So let me talk a little bit more about stage 1. That's the most important stage that you'll be doing for the first week or two. That was a big cough. I muted that one out for you guys. Okay, so the initial protocol is pulsing the red light at 50 hertz, 50% duty cycle. I want you to keep the red light at that sort of parameters throughout the first stage. Near infrared starts at 10 hertz and 50% duty cycle. So what does that mean? It means that there's 10 pulses per second, and that of the total output of power of the equipment, you're using about 50% of it. So you think of it like a dimmer switch. If 100% is 100% full power, bright, right? Like a full bright light bulb, it's at 50%. Okay, so we initially start with that and the lower pulse rate, and then we start to increase it after a few sessions, maybe 3, 4, 5, 6 sessions around there. You can start to ramp up the pulse rate and the duty cycle, especially for the near infrared. So I'm going to ask you to initially keep the red at 50-50, but you can start to increase the infrared, maybe go from that, let me back it up a bit here, go from that 10-50, 10 hertz, 50% duty cycle, and then bump it up to maybe 20-30 cycles per second and 60% duty cycle. So now you're in that stage 1 protocol, but you start at the very lowest level of the stage 1, and then now you're at the highest levels of stage 1 after maybe 3 or 4 sessions. Then after another 3 or 4 sessions, then you can go to level 2, or keep it at that if you're seeing really good results. Remember, for superficial areas and superficial incisions, you don't want to blast it too much, right? But if you're dealing with really deep things, you need to get the light deeper as well to the structures you can't see. So keep that in mind. And therefore, the time of the treatment will vary. Maybe a few minutes, 4 or 5 minutes for relatively superficial surgery, maybe like skin surgery, like the surgery I had, right, was relatively superficial, maybe 5 millimeters into my tissue or so, or whatever it was. I don't know, it was pretty gross, whatever, however deep it was. And hey, by the way, have you ever seen what a ganglion looks like in real time? He pulled it out and he showed it to me. It's like these gray, it was gray, and I didn't think it'd be gray. It's like a gray globule, kind of consistency of rice pudding, kind of gelatinous kind of thing, semi-transparent, but kind of grayish, opaque-ish at the same time. Really, really interesting. Anywho, I digress. Okay, so you want to use the time that represents the depth of what you're trying to do. So if you're doing like a really deep post-surgery area, like a post-hip joint replacement, you're going to be closer to 10 minutes. But if it's something more superficial, then you're going to use less time. Okay, hopefully that's clear and everyone understands the concept of why you'd be doing that. So remember, you can apply the laser therapy directly over stitches and staples and clear bandages. Make sure you use that transparent barrier. Now, if there is a bandage over the area, If you can remove it, that's what you want to do. If you can't remove it for whatever reason, or you're not comfortable doing it, or whatever the case may be, you'll have to treat around the area until that bandage is removed, or you can remove it. Okay. Not as good, obviously, but you still get some systemic effect around that wound bed area as well. So this and the next point here is that you can start using laser therapy pretty quickly. You want coagulation to initiate and to be in effect. So I would say wait for the next day. Then there's no bleeding. There shouldn't be any bleeding. If there is bleeding, you shouldn't be doing laser therapy because it promotes vasodilation, right? So assuming that the blood has stopped pouring out, which it usually does within 24 hours, then you can start to treat. It's usually recommended to treat daily for the first week or so if you can. I mean, I know it's not always possible. It is recommended. If you're in a scenario where you can treat someone in the morning and evening, or later in the afternoon for the first day or two, like we're doing with our post C-section, that would be helpful for both pain and accelerating that wound bed and reducing that inflammation as well too. But only for the first 2, 3, 4 days if possible. Now, the treatment plan itself, well, of course, that's going to vary on the extent of the surgery, right? If it's something Mickey Mouse like my finger, well, I only did it for, I don't know, a week or two, and then got lazy and stopped doing it. But although my finger seems fine, it's my, I won't show you which finger it is, because then people might get offended. But if it's deeper, then you want to have a much longer treatment plan. So the idea there is that you need to explain to your patient why you're doing this, for how long you might be doing this. And of course, you're going to be incorporating physical therapy and exercises really as soon as possible. I mean, if you're treated or been around post-joint replacement patients now, I mean, it's like get up and go pretty quickly, right? Because we all know that will facilitate healing faster. Just use a good clinical judgment about when you're doing that. The benefits of laser therapy, having that in your practice, is that you can start using laser therapy even before you can incorporate much physical therapy or exercises, like literally the next day, right? So that is a bonus when you're in clinical practice. When you're treating a post-surgical wound area that involves a joint, right? Like say a knee replacement surgery or something to do inside a joint or around a joint or whatever, usually what happens is you start to get edema and issues and bruising around the whole joint. So you want to treat around the circumference of the joint as well. So, for example, if I'm treating post knee replacement surgery, or let's say this, how about they did a surgery for medial collateral ligament repair. So they did the incision along the MCL, they repaired it, and there's an incision there. You want to treat around that area because it's not just that small incision that's affected, it's the tissue around it. But if they did an ACL surgery, right, they've gone inside the joint, and there's going to be swelling and edema inside the joint, inflammation around the joint. You want to treat around the circumference of the joint. For those areas, just to use the standard anatomical protocol, not the wound healing protocol, but in this case, the generalized knee protocol for areas away from the wound to help with edema and help with pain and inflammation. And this will facilitate overall faster recovery as well. All right. Well, did I finish on time? No, I'm late, but only 5 minutes. So let's take a look and see some questions here. I'll pull those up. How soon after surgery? I answered that one. What settings should be used and does change over time? I answered that one. What happens if you use too much laser? What is too much? I did answer, if you use too much, then the benefits aren't there. You won't hurt the person typically, but you're not going to help them. And what is too much? Well, you don't necessarily know that. So that's why you start really, really, really low. And that, generally speaking, if you start with that low amount of dosage, with that lower duty cycle, then you're not going to be overdoing it. So, the whole thing about, I got to use as much as possible is not what you're trying to do with photobiomodulation. You want to start pretty low, and then if you're not seeing pretty rapid results, start to increase it. So you'll know, but if you start too high, you don't know what's going on. Okay, so hopefully that answers the question. How can PBMT use directly over on? So if it's an open wound, that's a good question. I suggest using the laser. Well, first of all, I would suggest applying a clear, transparent wrap so you can put the array directly over the open wound. You can do that. Just make sure everything's hygienic. But also over the open wound itself, you can hover the probe directly over the wound bed, the open wound bed, hovering at a few millimeters so you're not touching into the wound itself, and that light will be absorbed into that, what should be forming granulation tissue, and hold it for, it varies, but maybe 5 to 10 seconds before you move it to the next point, and just sort of in a sort of crisscross pattern or a grid-like fashion, treat the entire open surface area of the wound. I didn't mention, but if you do have the red laser probe, and I kind of mentioned it, but you should add that as well. If you have the red laser probe, set that one to 50% power, continuous wave. It wasn't in there, but that's what I would do. And that also facilitates the light being held more superficially, because it only goes maybe 5-6 millimeters into the tissue. And it is also helpful for pain control. Question here, is it safe to use straight after surgery? I had laparoscopic surgery and hysteroscope to remove a septum and endometriosis. Straight after surgery, So I think I'd answer that, is not right after, give it a day. And if there's any bleeding, then wait. In our trial, we're doing it about an hour or 2 after the incision. So we're ensuring that it's not bleeding, and then we can start doing it. Are you looking for people to be in clinical trials? Right now, the one clinical trial, like, we're not running it. We've supplied the equipment to McMaster, and they're obviously taking, so if you're pregnant and you're want to give C-section in the McMaster area or the Hamilton area, then you can sign up for the trial. But that's the only one that we're doing currently. Okay, so a comment here from Betsy about finding the array kind of painful over the ankle. Yeah, so the malleolus in that area can be really sensitive, and sometimes that does happen. So a few things you can do there, Betsy. You can the arrays are kind of flexible, and they can kind of be held in a position so that they don't quite touch the skin. It's not ideal, but you still get a fair amount of light onto that tissue. Or I suggest that you don't strap it in. You just gently place it over the area. It's going to make some skin contact, but usually that's tolerable, as opposed to strapping it where it applies over pressure. Also curious in the time frame on average to treat target an area. Would you do a few sessions of, say, 10 minutes? So I think I've covered the treatment plan. Let me know if you're not comfortable with how I laid out the treatment plan, but essentially I did recommend daily. If you have the ability to treat twice a day for the first few days, that may be advantageous, but giving it some spacing in between, not like, every hour or something like that, maybe at least 3-4 hours, 5-6 hours afterwards. What are the physiological differences, the emission of continuous light versus pulse light from LED panels? Does the pulsing quality change the behavior of light? Well, I'm not going to answer specifically for LED panels, because pulsing is used in photobiomodulation in general, whether it's an LED panel or an LED array that touches the skin. And the purpose of pulsing is to create a dark phase where there's no light, to allow the cells that have absorbed the light to be stimulated and not overstimulated. So it uses the energy. As it uses it, what happens is, it gets a little complicated, but what happens is, of course, ATP increases and it starts to decrease, and reactive oxygen species also peak and then start to come down. It allows these to go up and down to create optimal environment in the cell. If you constantly blast the cells with too much energy, there's a feedback mechanism that slows things down. So by pulsing it, it's like feeding a fire. You put in a bit of wood, let it get going, and then you slowly feed wood into the fireplace or what have you. You don't just shove in 5 logs and hope for the best, because that doesn't work. Does a protocol with the same parameters work for all wound healing cases, or can we, or if there's some irregular cases that need to change the protocol? Like, I can't answer that because I don't know what you mean by irregular cases. Certainly, you can customize or change the protocol as you see fit. In the case of wound healing, tradition, that's what we would start with, is what I've recommended, where you would customize the time of treatment. So I mentioned 4 to 10 minutes is probably the biggest factor there. Pressure ulcers, someone's asking about, can it help with pressure ulcers? And absolutely, there's a good research on that as well too. So it can be used for, especially in long-term care, where pressure ulcers oftentimes appear when people are wheelchair bound or bound in their bed, can't get up a lot. Can a patient with deep brain stimulation implant use laser therapy on a knee replacement? Yes, I don't see any reason why not. Blood thinners, again, I don't see any reason why not. Okay. So Keith, hi, Dr. Z. Thanks for commenting that he used BioFlex on a nasty turf burn on his daughter last week, combined with polysporin and tegaderm. The skin healed extremely quickly. He said, amazing to see. Yeah, it's crazy how, like, seriously, if you're trying to get things healed and you go like, wow, this is taking a long time. If you put laser therapy on it, it will blow your mind how quickly it can actually heal. How long would it take to eradicate an old, long scar down the front that is raised? Okay, it's not going to eradicate it. It can help reduce some of the scar by anywhere from maybe 5-10% to maybe 20-30-40%. I've seen on keloid scars and chronic scars, and it takes a long time, months, if that's your, it takes a long time. 3 months post-knee surgery with prominent swelling, ligament, and meniscus repair, what protocol parameters should be considered? So if it's not a wound healing, then you're typically looking at the protocol for the anatomical area I'd recommend. So like the knee protocol is what I'd recommend for what you're asking, Maria. How many sessions are required that a person does not get a surgical scar? Well, I'm not guaranteeing there's not going to be a surgical scar. I'm just going to say that it's going to reduce the amount of visible scarring, sometimes dramatically, to the point where it's like in my case, it's you can't really even tell there was an incision there. Doesn't always happen that way. So I'm not saying it will get rid of it completely, but if you treat quickly and you treat through the first 2, 3, 4 weeks, then you'll reduce the scarring. Is BioFlex the same as low light laser therapy, or is it only near infrared? So yeah, so that's the thing, right? There's all these names: red light therapy, low light therapy. It's all photobiomodulation, and the wavelengths used are red and near infrared traditionally. They both have their benefits. We use both of those wavelengths, and I'd always recommend using both, depending on what you're doing. But most time you're going to use red and near infrared. And I can't go into all the reasons why. I have tons of webinars that talk a bit about that. Surgery on the head. I'm assuming asking about, can they do the treatment? And there was, I guess, some cancer removed or whatever. You just have to make sure that the cancer was removed. If there's any potential for cancer still being there, I wouldn't treat it. How does pre-op PBMT treatment have any benefits? Oh, good question. Stop photobiomodulation before surgery. I would not do it. I would give it at least a week, maybe 2 weeks, maybe even longer before surgery, because it has an effect on vascularization. While there's not a lot of research on it or whatever, I know anecdotally that there's more potential for more bleeding if you do it right up until surgery. It's only anecdotal though. So hi, Megan, you've talked about renting a BioFlex for 1 month to help with knee replacement surgery. Is 2 to 3 weeks of treatment enough? I just don't really want to comment specifically on your case because I would prefer that you consult the clinic with that because you should know your case, or you should consult with our clinicians there, and they can guide you through that because I don't know all the details. So I'd suggest you contact the clinic on that one. Question about using silicone patches over the wound in combo with photobiomodulation. Silicone patches. I'm not really sure about that, Maria. I don't have any experience with that, and I'm not sure the purpose of it. Any differences between PBMT from healing by primary intention and secondary intention? Yeah, I mean, essentially, Mark, is that if you can start treating very quickly with PBMT, the primary intention wound is going to be dramatically affected, and that's the ultimate goal. Can we use the laser probe on the head for wound healing? Yeah, with proper protection, you would, if there's a wound on the head, you would treat it like anywhere else on the body, as I suggested. Thanks, everyone. I appreciate you taking the time to watch. And I don't have the next webinars listed yet, but they will be by Friday. So tune in then and hope to see you another time. Bye now.